don't speak for the hospitals in Loudoun County, but we know that you work very closely with the hospitals. Some folks are concerned about our hospitals' ability to handle any surge of patients and whether they have the equipment necessary to care for patients with COVID-19. Can you speak at all about the readiness of our hospitals?
Yeah. We're very fortunate to have two hospitals that are part of very large hospital systems in Northern Virginia. And these are hospital systems that have gone through H1N1 and they've gone through Ebola of 2014-15. So they've all been checked out to be able to take care of infectious people very well. And they all have plans in place because it was important during H1N1, just as our planning is now for a large number of people potentially being sick, of how you would deal with the surge in sick patients. A critical piece to that, though, is for emergency departments who are amazing at taking care of emergencies and people have nowhere else to go for care. That's an important resource. So we do ask folks, if you have access to a doctor and you're not seriously ill, call up your doctor because your doctor may easily take care of whatever your illness is.
Dr. Goodfriend, some folks are wondering about Loudoun County Public Schools' decision to postpone classes for a week or so. I know, again, you don't make the decision for Loudoun County Public Schools, but obviously you're an important advisor to the school system. Is there anything that you can offer today about what the school's decision means for our community?
Yeah, we work very closely with the public school system. In Loudoun County, it seems like everybody has a connection with somebody in the school system, whether an employee or a student, or they have their church services there over the weekend or after school activities, and again have a tremendous working relationship, and we've been doing that through the coronavirus issue. There are three main reasons why a school or school system may choose to close. One is if someone who is infected with the virus was in a school, then there'd be a case for that individual school to be closed in time, just to make sure that there was disinfection occurred and no student was put at risk. And that did not occur in this situation. Another reason for doing it might be that while we know students, if they get infected, do fine, a lot of students, when they come home, go to families where there may be a senior citizen, and senior citizens are not doing as fine. So if we were to find that there was a large amount of coronavirus in our community and in our school system, that may be a case for closing the schools for an extended period of time so that we keep our seniors safe. Again, that's not the situation here. Really, as in talking with the school system, given how the situation has evolved over the last week of having our first cases, having a pandemic declared by the World Health Organization, having a real more significant, stringent approach to dealing with this, starting with President Trump's call to the nation last night. My understanding is they just really wanted to make sure they were doing everything right by their students, that all those recommendations of students having great access to hand washing, hand sanitizer, good, effective ways of determining if a student's sick, that they get sent home and don't pose a risk to anyone else, and taking additional steps that may reduce transmission within the schools are in place so that, again, not only that the students can be safe and the staff stay safe, but when those kids come home and if they have contact with high-risk individuals, and we know that that's primarily our senior citizens, our grandmas and our grandpas, and people with underlying medical conditions, that they're not bringing anything home to them.
And Dr. Goodfriend, Johanna on Facebook is asking about the severity of the illness, pointing out that we've seen a lot of data in the news about the severity of COVID-19 versus the flu. What do folks need to know about how serious COVID-19 is?
It can be very serious. The challenge is some infections are very serious, but they don't infect many people. And so we don't see a lot of people hospitalized or dying. And some infections affect a lot of people, but very few of them get seriously ill, so we don't see a lot of infections or dying. But the flu every year impacts millions of Americans and can cause up to 20, 40, 60,000 deaths in the United States. So far from what we know from other countries, COVID-19 is more serious in high-risk groups than the flu is. So our children tend to do very well with it, although we know that even with the flu, sometimes children get hit very hard by the infection. So we don't want anyone to get infected. But it's our seniors and those who are otherwise medically fragile that are the ones that have a real hard time fighting it off. We don't know if that's going to be the case if and when it comes to Loudoun County, but we have to assume that's the case, and we're really doing our best to see how we can safeguard our seniors and keep them safe as the virus passes through our community.
Dr. Goodfriend, some folks on Facebook are curious to know more about our first case that we announced on Tuesday. They're curious to know what part of the county he lives in, and also to understand why we sometimes in the past, such as when we've put out news releases about cases of measles, we've informed the public of all the places that individual has been, whether it's the airport or a grocery store, and why we did not provide that information in this case.
Yeah, and that's important to convey. When we find someone who's infectious, our job is to protect the safety of that individual and protect the safety of our community. And if we can do that while respecting the privacy of the individual, that's our obligation. So different viruses are spread in different ways. Measles is an airborne infection. And what that means is if I were to go into Dulles Town Center or a supermarket and I was contagious with the measles, everyone in the town center and the supermarket would be considered a contact. There's no way that we would be able to follow up with everybody who's in that building individually. So we reach out to the public and ask, if you were in this building at this time, you may benefit from being evaluated. For the coronavirus infection, it's not spread that easily. So what we do is when we find a case, we interview the individual, find out everywhere they've been, and everyone who was a close contact of them at times where they could have been sick. And if we can follow up with those individuals, then there's not a need to go out to the public to share that information. And for a similar reason, why we don't say more than, in this case, it's in Loudoun County, is really protecting the privacy of the individual. If we thought that it would add any protection to someone in the community by sharing where the person went or what part of the county they would be in, we would definitely provide that information because we owe it to everyone in the community to assure that they're safe. But if we can provide that assurance without potentially identifying where an individual lives, that's also our obligation.
Dr. Goodfriend, a number of questions on Facebook about what folks should do for planned activities or non-essential activities such as going to the movies or going to gatherings with friends. What is your recommendation about those activities at this time?
At this point, if you're not in a high-risk group, there's not a need to limit your activities. If you are in a high-risk group, excuse me, I'm going to sneeze in a second. Then
the proper way to say it.
then you really should consider limiting contact. So if you're a senior and that goes up, 60 to 70 to 80 to 90 to 100 each decade is a concern, then you should consider whether you should be going to the movies at this time or taking a long bus ride or going to a senior center, because we want to keep you safe. If you get infected with a coronavirus, even though we have no reason to believe it's floating around in our community now, then odds are you're going to be much more severely impacted than a 20, 30, or 40-year-old would be. But if you are 20, 30, or 40, at this point, there's not a reason not to go to the movies or go to Dulles Town Center or to go to the outlet mall if you're feeling fine. If you're feeling sick, again, just like during flu season, stay home, because you don't want to expose other people to your virus, whatever that may be.
Dr. Goodfriend, some folks are curious about another aspect of the case that we reported on Tuesday, whether that individual had, there's any potential risk to folks at Loudoun County Public Schools as a result of that case.
Yeah, and that's one of the things we look at closely. Again, not because people in the school system are at high risk, but because it's easy to transmit viruses in the school setting, particularly elementary schools. And once that amplifies, it allows more people to be exposed. And as I said, really the core is we want as few people to get sick as possible, but we definitely want to keep the virus away from our seniors and medically fragile folks. We have no reason to believe that the individuals that we've identified have any connection with the school system at all. It's one of the first questions we ask, along with other high-risk potential exposures that may have occurred.
What about pregnant women? What does the current situation mean for them?
From everything we've seen, the virus doesn't particularly attack a pregnant woman any harder than a non-pregnant woman of the same age, but you never want to get an infection when you're pregnant for a number of reasons. You know, if there was medication available, women who are pregnant get limited in the medication that they can take because they want to make sure there's not a harm to the baby. But also, we never want to get a woman dehydrated when she's pregnant. So even if it's not the virus itself, having a fever and having other symptoms may dehydrate a woman, and that can cause problems with the pregnancy by itself. But the virus itself, I'm not aware that the virus causes any problems to the fetus or harms the pregnant woman any more significantly than she would be if she was not pregnant.
Dr. Goodfriend, another question related to the movie theater scenario. Could people who are not showing symptoms be carriers, and would that be a reason why they shouldn't go to the movie theater or do some of these activities you were talking about, just by the sheer fact that they might spread the virus unknowingly in the community?
In theory, people can transmit the virus before they have symptoms. We also know that a number of people will get infected and may not realize that they have the symptoms, particularly young children. But that said, we don't have any reason to believe that the virus is being passed around from person to person in our community. The only cases we've seen in the region to date have been people who either had high-risk travel or were a contact of a known case. Easily, that recommendation may change if we start seeing people showing up who have no risk factors at all but test positive. And that's one of the main reasons that's important to get more testing capacity to our folks, so we can get a better understanding of who potentially might have the infection in our community.
Dr. Goodfriend, you mentioned earlier that senior citizens were among the population that is vulnerable. What do folks who operate venues that cater to seniors, whether it be a nursing home or an adult daycare that is operated by the county, what do folks need to know about the safety of seniors in those settings?
Yeah. And just like the flu, this tends to strike our seniors harder. But our seniors tend to be great at getting vaccinated, at calling their doctor as soon as they have signs or symptoms so they can go on medication. We just don't have those tools right now. So our biggest tool is not getting grandma or grandpa sick. But the people who care for them professionally, whether it's in a county senior center, assisted living facility, retirement communities, they have that expertise to know how best to keep them safe. We have very close relationships in the health department with our assisted living facilities, just because of that. What we don't want is having outbreaks of the flu in the winter, because they are such a high-risk community. There is specific guidance for those entities, and we try to get word out to them with the best information. And key parts of that are, what we do every year with the flu, of making sure there's good sanitation of surfaces, good checkups of individuals to make sure that they're not sick, and if they are, that they can get care quickly and be kept away from other residents. If there is infection in that facility, you may want to limit communal gatherings, so it makes it less likely that people transmit it to each other. But also, have a very low threshold to contact the health department, because that's, again, what we're here for, is to work with these entities to keep their residents safe.
Dr. Goodfriend, we reported on Tuesday that the known presumptive positive case here in Loudoun had attended the church in Washington, D.C. that has been in the news so much, which is prompting a lot of questions on Facebook about whether it's safe to go to church or to worship services. What do you say about that?
Yeah. So for the average person at this point in Loudoun County, it's perfectly safe to go to places of worship or other community gatherings if you're not in a high-risk group. If you're a senior citizen or if you have underlying medical conditions, definitely consider before you go to these areas, because we want to keep you safe. Additionally, if you're seeing people who appear ill in church, step back. And hopefully they feel comfortable not going to church if they feel ill. Other challenges with churches, there are a lot of rituals that involve shaking hands. Some churches have changed their practice, just like they did in H1N1, to keep folks safe. But also, I'm sure no one takes offense if you're shaking hands with somebody and then you use hand sanitizer afterwards. If that's part of your ritual, or you come up with new rituals of elbow bumping instead of shaking hands, those are the challenges with people coming close together, that you may pick something up from a close contact sitting next to you or shaking hands with you, or that there may be an ill person coughing and that you're within that 6-foot range.
Dr. Goodfriend, earlier you did talk about testing for coronavirus in Loudoun County. We're continuing to get some questions about that. Are you able to say how many test kits are available in our community? And can you clarify the difference between the specimen collection process versus the testing process?
So we're fortunate now that Quest and LabCorp, which are the two main private testing companies, are able to run tests. They each provide specimen collection kits to doctors' offices, and there is a limited number of those kits that are available. But it is a step forward compared to what we had last week when it was only the state lab. You'll hear terms like testing kits at doctors' offices, but those are truly just collecting the specimens, and then they get submitted to the lab for testing. It's not like a rapid flu test or a rapid strep test where the doctor could actually do the test in their office. It's a test where if they have the specimen collection tools, they can obtain it, submit it, and it may be anywhere from 2 to 4 days to get the results back.
Okay, and another question from Facebook. Folks are wondering, you talked about the transmission of the virus. People touch surfaces that may be infected. Do you know at this point how long the virus can live on a surface, so that as folks go throughout the community and touch frequently, touch surfaces, they can be mindful of that?
Yeah, there are ranges that I've seen anywhere from a few hours to a little over a day. And there's two pieces to that. How long can the virus stay active? But also, how long is it there where if you were to pick it up, you'd still be able to transmit it to somebody else or to yourself? Surfaces are not the primary way that this is transmitted. It's primarily transmitted person to person, either a person coughing on you or it's on a person's hand, and then you touch the hand and you put the hand in your mouth. So definitely good disinfection is important, and particularly high-touch areas, doorknobs, elevator buttons, railings. But what's really important is protecting yourself. So if you have touched a surface where you think others may have touched, if you're in the bathroom, wash your hands. And there are really good reasons, in addition to coronavirus, for washing your hands when you're in the bathroom. But in addition, at any point, put on hand sanitizer.
Is the testing for coronavirus free?
Through the state lab, there's no charge for the testing, but there is a limited number of tests. For private labs, easily that's covered by folks' insurance if they have insurance. That from the health department standpoint, we don't want cost to be a barrier to anyone. So if someone merits testing and they're in their doctor's office, the doctor can always call us up. If it meets state criteria for testing, we can do that for free.
And if somebody becomes ill with coronavirus or COVID-19, are there over-the-counter drugs available that could help with the symptoms, or what is the treatment?
Well, the main symptoms, again, are very similar to the flu. It's fever, chills, cough, shortness of breath. Some people won't have any of those symptoms, and they just have what's called flu-like illness. So things that typically address the symptoms. If you have a cough, a cough syrup or cough drops may help. Fever, Tylenol, Motrin can help. There's nothing that will, at this point, that would make the virus go away better. Your body has to fight it off. But at least during that time, there's ways that you can feel better until your body does that.
Do you have recommendations for parents who might have children in a private daycare or in-home daycares?
Yeah. So the decision that made by the Loudoun County Public Schools really should have no impact on whether a private school chooses to close, whether a daycare chooses to close, or other facility. It was not done in response to a problem in the school system. It was done out of an abundance of caution to make sure their students were safe. There's very good guidance for daycare facilities that's available. If folks go to the county's website at loudoun.gov/coronavirus, there are links to the CDC where they have guidance for different sectors of the community, and I'd encourage folks to go there, and as a parent to go there to make sure that the folks who are caring for your children are following all the steps they can to keep their kids safe.
Dr. Goodfriend, there's been a lot of reports in the media about jurisdictions across the country taking steps to limit the number of large gatherings. What do we need to know about that? Should that be going on in our community as well?
There's steps that include limiting of large gatherings as part of the mitigation effort. Mitigation means when we think the virus is here or may be here, how do we slow the spread of the virus? And one of the triggers we look at is whether people who are getting infected are getting it within the county for some reason that we don't know about. Right now, the cases that we're seeing in the region are all related to somebody we know about. If we find a case, we do a contact tracing, we test the contact, and that person comes back positive. To date, I'm not aware of any case in the region where people can't trace a positive result to somebody that we already knew about or a high-risk exposure overseas. At the time where that begins, where people are spreading it person to person in the community and we're not able to figure out where that's coming from, that's a time potentially you look at mass gatherings and to see whether it can still be done safely, whether you change the gathering in order to limit the risk, or whether there may be a recommendation not to hold the gathering in order to protect the folks in the community. We're not at that point yet.
Dr. Goodfriend, excuse me, some follow-up questions on your answer about testing again. Some folks are curious to understand what is the state's criteria for testing.
Yeah, so in part, it depends on how many tests we have to give out. What we don't want is someone who's seriously ill not being able to get tested because there are no test kits available in Richmond. So currently what we look for is the signs and symptoms of coronavirus. Is this a high-risk individual? Because definitely if this is somebody who's going to have a much more severe impact by being infected, it's important to know that. Are they hospitalized? Are they senior citizens? Do they have underlying medical problems? And what is their risk factor? Have they been to an area where there has been person-to-person spread, like New Rochelle, New York, or Kings County, Seattle, or Northern Italy? Or is it that they're, for example, they typically get seasonal allergies around this time of the year, and they're exhibiting that similar type of symptoms now? For that latter person, we'd ask them, well, it's very unlikely it's coronavirus, so let's wait a little bit till our testing ability is better, and if you're still having symptoms, test you. And this way we can test that person with the fever and the known contact or the high-risk exposure.
Dr. Goodfriend, do you think that the situation here in Loudoun and our region and around the world will get better or worse sooner or later? And what can you elaborate on that question?
Well, we don't know for sure. It will likely get worse in the short term. What folks are not sure of yet is, and you may hear this in a number of different places, is whether this tends to be like the flu and is a cold weather virus and tends to go away when the weather warms up. We don't know that yet because we're still in early March. We can hope that that happens, but hope is not a strategy of keeping folks safe. So our strategy is preparing for this getting worse, either right now, or if it is a cold weather strategy, from everything we know, it would very likely come back next winter, just like the flu comes back each winter.
Dr. Goodfriend, you talked about this earlier in the hour, but some more questions popping up on Facebook about Loudoun County Public Schools' decision to close. Some folks are indicating that there's rumors flying around about cases of coronavirus in the schools that prompted that decision. Is there anything you can offer about those rumors?
I can definitively say there are no cases of coronavirus in the school system. Even now the testing is available through private labs. Those labs are required to report their results to the state health department as soon as they come back. If there was positive cases in Loudoun County, we would know about it at the health department. We're not aware of any positive cases that are impacting the Loudoun County school system or any other school in Loudoun County at this time.
Do you know how many cases there are in Virginia?
Now that gets updated on a regular basis. As of yesterday, there were 9. It's likely going to be updated again, and we would expect our numbers to go up. As we look at contacts of known cases, because it spreads like the flu, if your spouse tested positive and you've been in close contact with your spouse for days while they were sick, there's a decent chance that you'll test positive. Just like if your spouse had the flu and you didn't get vaccinated, there's a good chance you're going to get the flu as well. So we expect those numbers to go up. What we're really looking for, though, is any sign that it's starting to spread on its own and not because of direct relationship to known contacts.
If it does get worse and we do see a bunch more cases occurring all at the same time, how is Loudoun prepared to deal with many cases of coronavirus at the same time?
So we know that the large majority of people who get infected with coronavirus do perfectly fine. They don't need hospitalization. But that said, our seniors and those with underlying medical conditions very easily may need hospitalization and very intensive care. And these are the time when we're starting to see increasing cases where it becomes very important that if somebody knows they don't need to see a doctor, but they're just worried, call up your doctor before you go in. Don't use up that time of the doctor where they could be spending it dealing with someone they could actually provide help to. And also, if you have a runny nose and you think it may be coronavirus, their doctor's easily not going to be able to do anything for you. So call your doctor up. If you don't have a doctor, then there are urgent care centers, there is the emergency room, but for the large majority of people in Loudoun County, your doctor should be able to at least talk to you over the phone and walk through what the possible issues may be. And if you go into the doctor's office, test you potentially for things that are treatable. Similarly, if you feel you need an ambulance and you think you may have come in contact with coronavirus, there's no reason not to take an ambulance, but at least let the dispatcher know your concerns that you may have had contact with coronavirus so the ambulance crews could dress appropriately when they take you to the hospital. If you don't need an ambulance, don't ask for an ambulance. Again, just like you would do in normal times. We're very fortunate, as I said, that we've got 2 great hospital systems in Northern Virginia that are both represented in Loudoun County. They have the ability to utilize all the hospitals in their chain in the region so that if one tends to get a little over busy, they have that capacity to move patients to other facilities.
Another question from Facebook, will we have a vaccine in Loudoun County next year?
From everything we know, sometime next year there'll be a vaccine. The challenge is, from what the experts are saying, it won't be here in time to prevent people from getting sick next winter should the virus come back. But hopefully there will be medications available. So again, this spreads very much like the flu, but for the flu you have a vaccine that's pretty effective, and you have pills, Tamiflu and relatives of Tamiflu, that are also pretty effective. Now you don't have either. The hope is that if this is a virus that's going to come back next winter, by that time at the very least we'll have a version of Tamiflu that works on this virus. So for those people who are seriously ill, at least that can reduce the chance that they need hospitalization or emergency care.
Dr. Goodfriend, some folks have heard reports about other jurisdictions setting up drive-through testing for coronavirus. Is that something that could be done in Loudoun, and is that warranted?
Definitely there could be a time where that's warranted. Right now our limiting factors are the testing abilities of the laboratories, not the ability or the desire from doctors to obtain specimens. So right now drive-through testing facilities wouldn't add anything to us, because we still would be limited by LabCorp and Quest and the state lab's capacity to process those tests.
Another question from a concerned expectant mother. Is it possible, if infected with coronavirus, that the virus could harm the unborn child?
And that's a very important question. I know we all want our children to be safe, whether they're born children or unborn children. I don't have enough information to say whether it causes problems to the unborn child, but we do have enough information to say that any viral infection in pregnancy is something you want to avoid.
Dr. Goodfriend, have any local hospitals reported any cases of coronavirus?
So I'm not aware of any hospitals in Loudoun County who have inpatients, patients staying in the hospital that were tested for coronavirus and came back positive. The cases that I'm aware of in Loudoun County are people who were contacts of known cases, and they were tested as part of that contact investigation process that the health department does behind the scenes.
Some folks are asking about cleaning and what products they should use to disinfect.
From everything we know, the same products that are great for killing the flu virus and the cold virus are good for this as well. It's really important that if you're in a situation where bleach might be a problem for someone, not to introduce bleach, but there are a lot of good products that are out there. Understanding that natural instinct right now for people is to buy more than they need. So there may be challenges finding things on the shelf, because people, just like in a snowstorm, people will buy 10 loaves of bread, 20 rolls of toilet paper just in case. There is some of that going on now with toilet paper, with bottled water, with baby diapers, with disinfectant wipes. So that's a challenge right now. But all the disinfectants that normally work for other viruses, from what we know, works very well for this virus.
Dr. Goodfriend, if somebody is suspected of being exposed to coronavirus or has in fact tested positive for coronavirus, are they required to quarantine or isolate?
So ever since January, where we've been working with the CDC and the airports to monitor people in our community who may be at high risk of being exposed to the virus. And that's been going on again since January. Those are all voluntary agreements. What we found is people want to do what's right. So if somebody is at risk of passing the coronavirus to others, everyone we've dealt with, when we've talked with them, they said, sure, I'll stay at home until I'm no longer sick and potentially able to transmit it, or if I'm feeling fine, I'll stay at home until the time has passed where I would develop symptoms. And so the challenge we're seeing more of is folks who are so concerned that they don't want to pass this on to other people that they'll stay home even when there isn't a recommendation to stay home. And that's happened a lot with our school system where parents really are mindful of other students in the school, and if there's any risk at all, they want to keep their students home. It's a natural inclination and desire, but from the health department standpoint, we have good recommendations of when it makes sense for someone to stay home and it makes sense for someone not have to stay home.
Some folks are hearing the term over the last 24, 48 hours, flatten the curve, and the measures, social distancing measures that are being discussed in order to flatten the curve. Can you talk about what that means and whether those types of measures are warranted right now in our community?
Sure. Flattening the curve is part of a mitigation strategy. So there's an outbreak curve that typically occurs when you have an outbreak of an infectious disease in the community, where it starts slowly, then picks up a little more steam, then all of a sudden a whole bunch of folks get sick, and then it'll come down again. We see that now in Wuhan, China, where for a long time they were having a significant number of new cases every day, but right now they're getting virtually no new cases in Wuhan, as the large majority of folks who would have gotten infected have already gotten infected. Particularly as we're waiting on medications to be available, the more we can put off when someone gets infected, the better. And that's part of flattening the curve. So for those math majors out there, so instead of having a line that goes like this in time, where you have the time on the bottom and the number of cases on the y-axis, you want to flatten it out so that that 50th person is getting it 2 months from now rather than 2 weeks from now. And that's what social distancing does. That's what personal protection does. You want anything that keeps that one person from spreading it to 2 more people, to spreading it to 4 more people, to 8, and so on. Slows that process down, makes it easier on our healthcare delivery system, and gets us that much closer to effective medications that'll help treat it.
Dr. Goodfriend, some folks are talking about on Facebook what's going on in other countries around the world, in particular in Italy. Mm-hmm. Are we at risk of something like what we've been reading about in Italy occurring here?
Yeah, Italy is unfortunately, what we're reading is that perfect storm of where a bad pandemic may impact a community. From my understanding, it's they have a much more significant proportion of their population that's 80 years or older. So folks who are getting impacted are much more likely to require hospitalization and further measures. And also a lack of appropriate medical care and bed care. So part of flattening that curve is getting to a point where you don't all of a sudden need a whole bunch of hospital beds overnight, but you need some hospital beds for a longer period of time. And that's critical for us being able to give the highest level of care to those who need it the most.
What procedures would you recommend that businesses or business owners take to safeguard their employees and the folks who come to their businesses?
Yeah, there's really good information for businesses on the coronavirus website. Again, you can get to that through loudoun.gov/coronavirus, and I'd encourage everyone, whichever sector they're in, look at that information to keep your staff and your patrons safe. With businesses, depending on what that business is, you have people coming together from all different areas for a short period of time, touching the same places, and then leaving again. So good disinfection, having your staff stay home when they're sick, and watching for areas for people who may be sick coming into your store are critical. Because one of the things we want to make sure of for a business to stay in operation, and that became very important during H1N1, is business continuity plans. There's good information if you're a business owner and you don't yet have a continuity of business plan, to go online and you can just Google continuity of business plan to look at those steps that you should be taking now, just in case the pandemic were to come to Loudoun County.
Dr. Goodfriend, some folks are worried about our first responders and the potential exposures that they may have. What is Loudoun County doing in terms of working with our fire and rescue and sheriff's office?
We have a very close relationship with our career and volunteer fire rescue folks. We also have a great relationship with their operational medical director, Dr. Morgan. The key piece is, on the one hand, if you need an ambulance, call for an ambulance. We want everyone to get the best care at the best time. If you think you may have been exposed to coronavirus, let the dispatcher know that during the call. That said, our fire rescue staff go in assuming when they get a call that someone may be infectious. And again, it could be tuberculosis, it could be coronavirus, it could be the flu. But their job is to come prepared, and they're reinforcing that training with our fire rescue staff over the last several weeks to best keep them protected.
Let's see here. We've got a few more questions online. Let's see. Some folks are asking, you were just talking about flattening the curve and whether you believe Loudoun County Public Schools' decision will accomplish just that.
And I would ask people to follow up directly with the school system. We did work very closely with them when they made that decision to close. My understanding is one of the driving forces was that they really want to be prepared for when and if this gets worse. They don't want to be playing catch up with their students and their staff's health, and they're taking this time out to make sure that all their buses, their schools, their staff are prepared. Again, we hope that it doesn't get worse, but in the event it does get worse, it may get significantly worse, that they would be prepared.
In the event people are interested in monitoring or following the number of cases as they develop in our community, in Virginia, and in the region, what's the best place to look for that information?
For the number of cases in Virginia, the Virginia Department of Health has a great website. You go to vdh.virginia.gov. You'll see that really omnipresent coronavirus picture. That it's a little ball and everyone is using it. So, go click on that. That will tell you fairly up-to-date information on the number